Welcome back to Bloom. Do you have stubborn fat that dieting and exercise just can't remove? Then you'll want to hear about Coolsculpting, which can reduce that stubborn fat without surgery, dieting, or exercise. Here to tell us about Coolsculpting is Dr. Ann Hermann. Welcome back, Dr. Hermann.
Thank you so much. Good to be back.
I'm glad you're back, but before we dive into Coolsculpting, you've been serving Tampa Bay's community since 2004, so tell us a little bit about your practice and your philosophy.
Yeah, so I founded Hermann Wellness in 2004 with the idea of helping people as much as possible through non-invasive, minimally invasive cosmetic procedures. We also offer nutrition and hormones. So really with the idea of feeling better and looking better.
And having that confidence really does help, from the inside out. And so I know what we're talking about, Coolsculpting, really does that for a lot of people. And how has Coolsculpting helped your patients achieve their goals and feel better about themselves?
Yes, so Coolsculpting is a non-invasive procedure, which is really a cool laser that reduces the volume of fat in the area where the laser is applied by 25%.
Wow.
Very comfortable. People basically can relax during the procedure and really no downtime. Maybe take it easy the day of and the day after. Yeah. But so it's an amazing way to reduce fat without, the risks of surgery or scars. Yeah,
and that's amazing. Something very frustrating for a lot of people is, sort of reducing that fat. So you talked a little bit about the cool laser. Can you tell us more about what the procedure involves when your patient sort of selects an area?
Sure. So we typically have different size hand pieces. So we can do a small area, anything as small as sort of under the chin or above the knee. Probably the most common area is the abdomen and the flanks. And essentially we just hook the laser up to the area. It feels sort of like suction and cooling. And people we give you a tray and snacks. We have a TV in the room. People just kind of lean back. And, some people bring in their little workstation and get work done. And meanwhile, the machine will be on for about 20 to 45 minutes, depending on the area and what we're doing. Multiple areas, we often will, then detach the laser and then hook it up to another section. So if people are doing, say, an entire abdomen, it may be 4 sections. So they may be here for 4 hours, something like that. And it will reduce the volume by 25% on average per session. So some people will decide to come back and have a second session, if they're looking more for 50% volume reduction.
And so what we're seeing, it's talking about sort of personalized plans. So if someone comes into you and they kind of say, I don't know what I want, but I know I want, this sort of Coolsculpting procedure. Can you help guide them on what would be the best plan of action for them and sort of get rid of any fears? Because sometimes they might be afraid of invasive surgeries, and this is not what that is. So how would you guide someone that came in and knew that's what they wanted but wasn't really sure?
Absolutely. Typically we'll do a visit where we talk about what areas they're interested in. The patient gets a robe, and then we look at the different areas, we evaluate those areas and see, if they're, if what they're needing is Coolsculpting. I mean, some people, it's not fat, it's loose skin. That would be a different procedure. We have tightening procedures, that's different. Some people, if the fat is, if I can't grab it, it might be under the muscle. So, and that, unfortunately, Coolsculpting would not be appropriate for.
So you take time to make sure they're getting something that's going to give them that 25% reduction.
Absolutely.
So this is not, though, Coolsculpting is not a weight loss program, but rather fat reduction.
Right. It's the best candidate is someone who really has certain areas that just don't go away, even when we lose weight. There are just these certain little pockets that we call it fluffy fat. They really don't even weigh a lot, but they just kind of bulge or stick out in a way.
I'm sure as you're talking,
everything looks
everyone
better
watching
as you do
is thinking about that one area on their body. So we all have this. So this is what's the target for them, not weight loss, but really that fat reduction.
That's right. That's right.
And is this a popular procedure you guys have?
Oh, yes. Yeah. Very. I mean, and then we have a lot of repeat where people will try the abdomen, like it, then come back for, the back or the arms or something. So because it is effective and not too hard to receive.
Yeah, well, I think the results and the pictures were very dramatic.